So a concussion is really a kind of traumatic brain injury. And so the term traumatic brain injury means everything from a mild concussion all the way to major brain trauma from car accidents, from war injuries. And so concussions are kind of the mildest form of traumatic brain injury. And really it's an injury of the nervous tissue directly. There's no anatomical changes, so there's no bleeding, there's no death of tissue like you have in a stroke, and so it's just basically an injury to the tissue that occurs from specific kinds of trauma. Other brain injuries are much more what we call focal brain injuries and are usually much more severe. So those include different kinds of hematomas, which are subdural, which means bleeding outside of the brain, to an epidural or intracerebral hematoma, which means bleeding within the brain. We always used to kind of consider this what we call a silent epidemic, and it's not that concussions never existed before. They did. It's just that people really covered them up. And we know that up to 50% of concussions really have never been reported, or you didn't used to be reported to the schools and to the athletic trainers at the schools. Why is that? Athletes hide symptoms. They know if they go to a trainer that they're going to be told they can't play anymore. Coaches want the players to play, so they don't want to hear that the athletic trainer is saying, hey, so-and-so's got a concussion, they've got to sit out. Well, that's the star quarterback. What do you mean he can't play next week? Nowadays, it is written in law in New Jersey that the athletic trainer and the physician have the final say on who's able to play and who's not. Schools are not allowed to let kids play unless they've been signed off by a doctor. And more importantly, really, everyone now has a duty to report an injury. So if you're even a referee and you see a kid go down and he kind of pops up, but he doesn't look right, it's your duty as a referee to report that child to the coach and to the athletic trainer of that team. So you can't, even if you think somebody may have had a concussion, and I think in the past there's a lot of that, oh, Johnny doesn't look good, but they just let him keep playing because nobody pulled him off the field. But nowadays it's actually a duty to report it, and that's now in law as of last year. So when we have an injury of the brain tissue, the brain releases some chemicals. Calcium and glutamate have been the two chemicals which are kind of most important, and these chemicals do two things. One is that glutamate actually causes the brain metabolism to speed up, and so it's kind of the signal to the brain that there's been an injury and to try to fix it up. The problem is the calcium causes the blood vessels into the brain to constrict down and to stay tight, and so normally your blood vessels into your brain open and close depending on the needs of the brain. And what happens with a concussion is that those blood vessels are constricted down and they don't open, and so that's why most of the symptoms of a concussion occur. And really the hallmark of a concussion at the sideline, or when it really happens immediately, for most people is confusion. So when you go to talk to the kid, the coach talks to the kid, whoever's there to talk to the kid when they first get hurt, they just are confused. They're not focusing on you. Their eyes are kind of staring off into space. They can't concentrate on what's happening around them. They can't really make sense when they talk. Sometimes you see kids get up and go to the wrong huddle. That's always a good sign that something's wrong and the kid should probably be pulled out. We do know that definitely that younger patients need more time. I have a bunch of kids that are like 10 and 12, and they've taken forever to get better. And why that is, we're not really sure, but obviously it's a growing brain. It doesn't seem to handle that injury as well as a brain that's a little bit more mature. So when can we decide folks are better and ready to go back to playing? And so first of all, they've got to feel fine. Their neurological symptoms have to be gone. Their emotional symptoms have to be gone. They have to be back at. I tell the kids you have to be back at school full time for a few days and being successful in school and doing your schoolwork. And then we can talk about what the next steps are. But your brain's got to be better first.